The topic is anemia of chronic diseases. So what is anemia of chronic diseases? There are variety of anemias are there. Some are hemolytic anemia, some are microcytic anemia, some macrocytic anemia, acquired hemolytic anemia, congenital anemia. But this is a different topic. This is anemia of chronic diseases. This is very important. In day-to-day practice, we are seeing this type of cases. So this is very important. And you like so much about this topic, and it's a great information. So what is anemia of chronic diseases? Among the most common anemia and the one most prevalent in the hospitalized patient. So this is one of the most common anemia and is most commonly seen in the hospitalized patient. That is anemia of chronic disease. In some patient, the predisposing illness may not be apparent. Sometimes there is no predisposing condition, but patient having the chronic disease. Inadequate iron delivery to the marrow despite the presence of normal or increased iron stores. So in this anemia, indirect iron delivery to the marrow despite the presence of normal iron stores means there is a normal iron store, but there is a decreased iron delivery to the marrow. Generally, the anemia due to the chronic inflammation and endocrinopathy or liver disease are of only moderate severity. In contrast, the anemia remains often severe. So what are the common causes of anemia of chronic diseases? Like CKD, chronic kidney disease, diabetes, and sometimes liver disease and some other long-standing conditions. So common condition of this anemia of chronic disease is CKD, endocrinopathy like diabetes, like chronic liver diseases, CLDs, and sometime any malignancy or cancer. So this is the anemia of chronic disease, common causes. With chronic, in all the condition, because of the chronic infection, renal disease or hypometabolism, endogenous erythropoietic production inadequate and for the degree of anemia observed. So the basic pathology in the anemia of chronic disease, because of any chronic inflammation, it causes decreased release of erythropoietin from the kidney, and because of this decreased erythropoietin from kidney, it causes anemia of chronic inflammation. The anemia of chronic disease are characterized by according to etiology and pathophysiology. First, the name of inflammation associated with the chronic inflammatory states such as inflammatory bowel disease, rheumatoid arthritis, chronic infections, malignancy, and various conditions. It is mediated through the hepcidin. So, chronic inflammatory condition like you all know CKD, CLD, inflammatory bowel disease, rheumatoid arthritis, chronic infections. SLE is very important. Systemic lupus erythematosus is one of the important causes of anemia of chronic inflammation. All these conditions resulting in the reduced iron uptake in the gut and reduced iron transfer from the macrophages to the erythroid progenitor cells in the bone marrow. This is referred to as iron restricted erythropoiesis since the patient is iron depleted. So there is also reduced response to the erythropoietin and elaboration of hemolysis shorten the red blood survival and the production of inflammatory cytokine. So the serum iron is low in the anemia of chronic inflammation. Second, the anemia of organ failure can occur with kidney disease, hepatic failure, endocrine colitis. Erythropoietin is reduced. The main important pathophysiology is reduced erythropoietin. So erythropoietin reduced in the red blood cell mass, decrease in the response to the diminished signal for red blood cell production, the serum iron normal. Third, the anemia of elderly is present in the 20% individual overall. So this anemia of chronic disease is commonly seen in the elderly patient and 20% of individual over the age of 85 at the time of diagnosis. This anemia of chronic inflammation is a consequence of relative resistance to the red blood cell production, the response to erythropoietin, a decrease in the erythropoietin production related to the nephron mass, and negative erythropoietic influence of the low level of chronic inflammatory cytokine in the older adults. Here, serum iron is normal. Sometimes more than one mechanism may be present. For example, in ants, the human immunodeficiency virus can directly attack the hematopoietic cells and the suppress erythropoiesis. In chronic malaria babesiosis, the parasite enters circulation and triggers the destruction. Another is anemia associated with acute infection, inflammation, typically mild. So, anemia of chronic disease is the primary due to the failure of erythropoietic production by the diseased kidney and the reduction of the red cell survival at the level of this anemia correlated with the stage of CKD. So, this is very important. So, now anemia secondary to chronic disease. What are the common condition which causes the anemia of chronic disease? Inflammation like rheumatoid arthritis, SLE, inflammatory bowel disease, chronic infection like malaria, babesiosis, cancer, all malignancies, connective tissue disorders like Sjogren's syndrome, SLE, systemic sclerosis, renal insufficiency like CKD, endocrine disorder like diabetes, hypothyroidism, hypoadilism. So this is the mechanism of developing the chronic anemia of chronic disease in the rheumatoid arthritis. It is a vicious cycle. The chronic disease causes chronic infection, chronic causes the bone marrow suppression. This is the pathophysiology of how this anemia of chronic disease develops. Now, this anemia of chronic disease comes under the heading of hypoproliferative anemia. So, how to diagnose of the hypoproliferative anemia? Anemia mild to moderate severity, mild to severe, and mild. So, MCV is 60 to 90, in the mild 80 to 90, and mild to severe 90, and the mild is abnormal. Morphology, normomicrocytic, normocytic, and the TIBC is increased and decreased. On the basis of this MCV morphology, saturation index, TIBC, saturation seroferritin, we diagnose the various type of anemias. So, here the hematocrit really falls below 60% baseline, the MCV is usually normal, slightly reduced, red cell morphology. In CKD, cell morphology is usually normal. A serum ferritin value less than 30 mg indicates the coexistent iron deficiency. These are the slide where we are seeing the various type of cells. Spur cells. The spur cells are recognized as the distorted RBCs. With serous irregularities, they also got the acanthocytosis. Here you see, so this is the spur cell. Here anemia we find the echinocytes. So here is the echinocytes. This is the echinocyte cells. The red cell in the uremia may occur the numerous necrosis, small spiny projections such as known as echinocytes. So in uremia we find a specific RBC, that is echinocytes, and we find the acanthocyte in case of the spur. Now, after diagnosis of this anemia of chronic diseases, treatment. What is the treatment of anemia of chronic disease? This is very important. The main aim of this treatment of the anemia of chronic disease is treat the primary cause. And what is the primary cause? If primary cause is chronic inflammation, to treat the inflammatory condition. If the primary cause is CKD, treat the CKD. If the primary cause is endocrinopathy, treat the endocrinopathy. So primary management is to address the condition causing the anemia of chronic disease. When the anemia is severe or adversely affecting the quality of life, function status, or there is a dyspnea, we can admit the patient and we transfuse the blood and we can give erythropoietin or darbepoetin. The indication of recommended erythropoietin are hemoglobin less than 10 gram. So when patient hemoglobin is very low, like hemoglobin concentration below 6 gram or below 5 gram, then patient life is disturbed. In this case, we have to admit the patient and we have to transfuse the blood cells. Second thing, if patient is not so much dyspneic but patient is comfortable but still slight level of dyspnea is there, in that case we can give erythropoietin injection. So what is the indication for giving erythropoietin is hemoglobin level is below 10 gram deciliter. The indication of recommended erythropoietin level is less than 10 gram. Anemia due to the rheumatoid arthritis, inflammatory conditions, hepatitis C, all these conditions where we can give regular erythropoietin supplementation. The dosing and schedule of recombinant erythropoietin are individualized to maintain the hemoglobin between. So target hemoglobin in case of the anemia of chronic disease is 10 to 12 gram per deciliter. Below this we can transfuse or blood or we can give regular basis erythropoietin. In patient with CKD, the usual dose of erythropoietin is 50 to 150 unit per kg, 3 times a week intervals. It is a costly drug, so we have to keep this in mind that patient is in need or not. The use of recombinant erythropoietin is associated with increased risk of the venous thromboembolism and arterial thrombotic conditions. Thank you. So this is all about the anemia of chronic disease. It is a very important technique, and it is we are seeing this condition day to day practice. So diagnosis is very easy and treatment is very easy. So I think now you must know about the anemia of chronic diseases, and it is very common. Thank you very much.